If you were instructed to use MiraLAX and Dulcolax for your colonoscopy, this video will walk you through the preparation step by step. This bowel prep does not require a prescription, but it is very important to follow the timing exactly. I'm Dr. Francis Horenstein, a gastroenterologist at DigestWell Health. Before your procedure, there are things you need to buy. One is one large bottle of MiraLAX 238 grams or 8.3 ounce, 4 Dulcolax tablets, and two 32-ounce bottles of a sports drink such as Gatorade. Do not choose a red-colored sports drink. If you have diabetes, choose a zero sugar or low-calorie clear drink such as Crystal Light. Do not eat any solid food for the entire day before your colonoscopy. Drink only clear liquids. Try to drink at least 8 ounces of clear liquid every hour after you wake up to stay hydrated. Avoid red liquids, alcohol, milk, creamer, juice with pulp, soup containing solid pieces, and anything you cannot see through. At 12 noon, take 2 Dulcolax tablets. Swallow the tablets with an approved clear liquid. At 2 p.m., divide the entire bottle of MiraLAX evenly between the two 32-ounce bottles of sports drink. Put the caps back on and shake both bottles thoroughly until all of the powder has dissolved. You may refrigerate the mixture if you prefer it cold, but refrigeration is not required. At 6 p.m., begin drinking the first bottle of MiraLAX mixture. Drink 1 8-ounce glass every 10 to 15 minutes. Drink each glass promptly and finish the entire first bottle within 2 hours. Stay close to a bathroom. You should begin having frequent watery bowel movements soon. If you have not had a bowel movement by 7 p.m., take the remaining 2 Dulcolax tablets. If you have already started having bowel movements, do not take those additional tablets unless your written instructions tell you to. 4 hours before you leave for your procedure, begin drinking the second bottle of MiraLAX mixture. Drink 1 8-ounce glass every 10 to 15 minutes, just as you did the evening before. Finish the entire second bottle. Stop drinking all liquids 3 hours before your scheduled arrival time. Your bowel movements may begin brown and contain solid material. As you continue the preparation, they should become watery and lighter in color. By the end, the liquid should appear clear or pale yellow without solid pieces. Even if your bowel movements appear clear early, finish the entire preparation unless your doctor tells you otherwise. Here are some helpful tips. Chill the mixture if the taste is difficult for you. You can drink it through a straw if that makes it easier. And if you feel nauseated, pause briefly and restart at a slower pace. Use petroleum jelly or a barrier cream to protect the skin from irritation. Call DigestWell Health if you have repeated vomiting, severe abdominal pain, and cannot finish the preparation or unsure about your instructions. Remember, clear liquids only the day before, 2 Dulcolax tablets at noon, mix the MiraLAX at 2 p.m. Drink the first bottle at 6 p.m. Drink the second bottle 4 hours before you leave, and stop all liquids 3 hours before your arrival time. Following the preparation correctly gives your doctor the best possible view during your colonoscopy. If you have questions, call your DigestWell Health team before your procedure day.